Have you ever rushed through a busy morning on nothing but coffee, swallowed a painkiller to push past a headache, skipped lunch, and then wondered why your upper belly feels like it's been scrubbed with sandpaper by dinner? That raw burning, the uncomfortable fullness after just a few bites, the sour burps that rise at the worst moments, your stomach might be trying to tell you something. The name for that something is gastritis, which simply means inflammation of the stomach lining. In this video, we'll explain what's really going on in plain, everyday language, why it happens, how it shows up, why it can be serious if you ignore it, and most importantly, how to prevent it from hijacking your day. No scare tactics, no complicated jargon, just simple, reliable health knowledge you can use. Your stomach is not just a bag of acid. It's more like a carefully designed workspace with safety gear. On the surface of the stomach is a protective layer of mucus and special cells that keep strong acid and digestive enzymes from damaging the tissue beneath. When that protective layer is thinned out or disturbed, the acid that normally helps you digest food can irritate the raw surface and cause inflammation. That irritation is what we call gastritis. Sometimes the inflammation is sudden and temporary, think rough weekend, after too much alcohol or a short burst of painkiller use. Other times it's a slow, quiet burn that can go on for months or years with few obvious symptoms until complications appear. Either way, knowing the triggers is the first step toward feeling better. Two causes stand out across the world. The first is a bacterium called Helicobacter pylori. Most people just say H. pylori. It's a spiral-shaped germ that can live in the stomach lining. Many of us pick it up in childhood and never know it's there. For some, it sits quietly for years. For others, it irritates the lining and contributes to ulcers and long-term problems if it isn't treated. The second big cause is regular use or overuse of NSAIDs, the common pain relievers like ibuprofen or aspirin. These medicines are incredibly useful, but in frequent or high doses they can weaken the stomach's protective barrier and make the lining vulnerable to acid. Taking them on an empty stomach or along with alcohol pushes the risk even higher. This doesn't mean you can never use painkillers. It means you should use them wisely at the lowest effective dose. And check with your clinician if you need them regularly. Other contributors can nudge the stomach lining from okay to irritated. Alcohol is a classic irritant. Heavy drinking can inflame it and even erode the surface. Severe physical stress on the body, such as major surgery, serious infections, trauma, or critical illness, can temporarily reduce blood flow to the stomach lining and weaken its defenses. Bile reflux. Stomach exposure to bile that usually flows the other way can inflame the tissue too. Specific medical treatments like radiation therapy and certain chemotherapy drugs can irritate the stomach in predictable ways. There's also autoimmune gastritis, in which the immune system mistakenly attacks the stomach's own cells over time. That chronic form slowly thins the lining and can affect nutrient absorption, especially vitamin B12, so it requires monitoring and a medical plan. A helpful mental picture is to imagine your stomach as a tiled floor covered by a slick, protective mat. H. pylori loosens some of the tiles. NSAIDs thin the mat. Alcohol makes the surface raw. Once the mat is thin or missing, the powerful acid that usually works for you begins to sting and inflame the floor underneath. That sting shows up in everyday life as symptoms. But not everyone feels the same things. Some people report a burning or gnawing ache high in the abdomen, right in the pit of the stomach. Others feel uncomfortably full after just a small meal, or they burp more, or feel bloated and nauseated. Appetite can drop. Symptoms may improve after eating for some people and worsen for others. And here's the tricky part. Sometimes gastritis is silent. You might have inflammation without any obvious warning until complications develop, which is why paying attention to patterns and risk factors matters. There are certain red flags you shouldn't ignore. Vomiting blood or material that looks like coffee grounds can point to bleeding. Black or tarry stools are another warning sign. Significant unintentional weight loss, severe or persistent pain, trouble swallowing, repeated vomiting, or symptoms of anemia like extreme fatigue, dizziness, or looking unusually pale deserve timely medical attention. Those signs don't automatically mean something terrible is happening, but they do mean you shouldn't wait it out. A clinician can sort through your symptoms, ask about medicines and alcohol, and decide what tests are appropriate. Speaking of tests, the plan usually starts with a good conversation. What are you feeling? When did it start? How often do you use pain relievers? How much alcohol do you drink? Do you have a history that suggests H. pylori exposure? Depending on the answers, your clinician might order a breath test or stool test to check for H. pylori, and sometimes an endoscopy to look at the lining directly and take tiny samples if needed. A blood test may check for anemia or vitamin levels in chronic cases. The goal isn't just to soothe symptoms. It's to find a cause. Treating the cause is what prevents repeated inflammation and the complications that follow. Why does gastritis deserve respect? Ongoing inflammation can damage the lining enough to create ulcers, open sores that can bleed. That can lead to anemia and, in serious cases, require urgent treatment. Repeated ulceration and scarring can narrow the outlet of the stomach, causing persistent vomiting after meals because food can't move along normally. In long-standing chronic gastritis, particularly certain types that thin the lining cells, can change in a way doctors call intestinal metaplasia, which is considered precancerous. That doesn't mean gastritis equals cancer. It means years of untreated damage increase risk, and it's a reminder that finding and treating the root cause is the smart move. So what can you do starting today? Let's begin with pain relievers. If you take NSAIDs often, consider whether you truly need them daily or if there are non-drug options like gentle stretching, physical therapy, heat or cold packs, or alternative pain strategies that could help. If you need NSAIDs, use the lowest effective dose, take them with food, and avoid doubling up. Don't take multiple NSAIDs at the same time. And be cautious with combination cold or flu products that may contain hidden aspirin. If you're at higher risk, ask your clinician whether you should pair the medicine with a protective agent, at least for a period of time. Next, look honestly at alcohol. If your stomach feels better on the weeks you drink less, that's your body telling you something. Reducing intake, especially avoiding binges, can calm an irritated stomach and speed healing. At the same time, if you test positive for H. pylori, follow the treatment plan carefully. Eradicating the bacterium typically requires a combo of antibiotics plus an acid-reducing medication for a couple of weeks. It's vital to finish the course and, in many cases, to have a follow-up test to make sure it's gone. Clearing H. pylori lowers the chance of future ulcers and addresses one of the most important drivers of long-term stomach problems worldwide. Daily habits around food can make a surprising difference. Eat regular, balanced meals instead of skipping, and then overeating. The stomach handles steady routines far better than feast or famine patterns. Chew well. Give yourself time. Fast meals often mean lots of swallowed air and poor digestion. Don't lie down right after eating, and keep heavy late-night meals to a minimum. There isn't a one-size-fits-all gastritis diet, so the smartest approach is to notice your personal triggers. For some, very spicy, very fatty, highly acidic, or ultra-processed foods worsen symptoms. For others, those same foods barely matter. A short, simple food diary for 2 weeks can help you spot patterns. And if your main complaint is chest burning and sour fluid coming up the throat, you may be dealing more with reflux than gastritis. The two can overlap, and your clinician can help you tailor strategies for each. Good hygiene has a role too. We don't know every single pathway for H. pylori transmission, but basic habits help. Wash hands regularly, use clean water, and avoid sharing toothbrushes or utensils, especially if someone in the household has been diagnosed with H. pylori. These small steps can reduce how often stomach bugs move from one person to another within families and communities. If you're going through a period of major stress, whether it's illness, surgery, or a tough life event, protect your stomach proactively. That might mean a short course of acid-reducing medication if you're at higher risk, or simply being mindful about alcohol, painkillers, and meal timing while your body is under strain. Let's clear up a few common myths. First, spicy food doesn't usually cause ulcers by itself. Before scientists discovered H. pylori and understood NSAIDs, spicy meals and stress got most of the blame. Today we know the main culprits are that bacterium and those painkillers. Still, if spicy meals flare your symptoms, it's sensible to go gentler while your stomach heals. Second, no pain, no problem isn't always accurate. Chronic gastritis can be quiet for years, especially with H. pylori or autoimmune forms, so it's wise to check in if you have risk factors or stubborn digestive issues. Third, it's no big deal, downplays real risks. Most gastritis is very manageable, but repeated, untreated inflammation can lead to ulcers, bleeding, anemia, and in some long-term cases, cellular changes that raise cancer risk. Taking the root cause seriously is what keeps small issues from becoming big ones. What about popular remedies? Do they help? Antacids can give quick, short-term relief when symptoms are mild. Over-the-counter acid reducers like H2 blockers or proton pump inhibitors can quiet the acid long enough for the lining to recover, especially when paired with lifestyle changes. But remember, these are tools, not permanent solutions. The priority is to fix what's driving the inflammation, treat H. pylori when it's present. Use pain relievers wisely, moderate alcohol, and learn your personal food triggers. Some people find probiotics useful during or after antibiotics to keep digestion comfortable, but the best approach is individualized. Discuss it with your clinician if you're curious. And if you have autoimmune gastritis, ask about screening for deficiencies like vitamin B12 and iron. Replacing them can make a huge difference in energy and well-being. If you're worried you might have gastritis right now, here's a simple game plan. First, step back and review your last 2 weeks. Have you relied on NSAIDs most days? Have you been drinking more than usual or skipping meals and then overeating? Dial those habits back and see what changes over a week or two. Second, track your symptoms. A tiny note on your phone what you ate when symptoms hit. Any medicines you took can reveal patterns you'd never notice otherwise. Third, don't ignore red flags. If you see blood, develop black stools, lose weight without trying, or feel severe or persistent pain, get medical advice promptly. That's not the time for guesswork. And if symptoms linger even after you've cleaned up the habits that might be irritating your stomach, ask your clinician about testing for H. pylori or other causes. Let's pull the big ideas together. Gastritis means your stomach lining is inflamed. The most common drivers are H. pylori and overuse of NSAIDs, with alcohol, severe body stress, bile reflux, certain treatments, and autoimmune processes also playing roles. Symptoms can include upper abdominal pain, indigestion, early fullness, belching, nausea, and sometimes no symptoms at all. Red flags: vomiting blood, black stools, significant weight loss, severe pain, trouble swallowing, or repeated vomiting deserve timely care. Prevention focuses on smart medication use, thoughtful alcohol habits, simple hygiene, steady eating routines, and treating the root causes rather than only soothing the surface. Small, consistent changes add up, and timely diagnosis keeps minor irritation from becoming a major problem. You don't need to memorize medical textbooks to protect your stomach. You just need a straightforward plan. Respect the lining, use pain meds wisely, keep alcohol in check, listen to your body's triggers, and get tested for H. pylori if symptoms stick around. With those steps, most people feel better, heal faster, and stay ahead of complications. And if you're someone who likes to help family and friends, share these simple ideas because a lot of people in your life are probably dealing with the same symptoms in silence. If you found this video helpful, don't forget to like, share, and subscribe to Healthy Wisdom for more simple and reliable health knowledge every week.